Hi, my name is Sanjay Gupta. I'm a consultant cardiologist in York. Um, I'm transmitting this from Barcelona, where I am for a meeting. And I thought I'd share with you some insights that I've gotten from the meeting, in particular, the risks of over medication. My big concern these days is that people are given lots of tablets, and many of them are not told why they're taking those tablets. And actually, we have somehow lost the sense of knowing exactly why we're giving certain things, what they exactly are for. So as doctors, sometimes doctors just prescribe tablets because everyone else prescribes them, and they don't really know what those tablets are doing and what the evidence base is behind them. And one of these tablets is aspirin. Aspirin was hailed as the miracle drug a while ago, and pretty well much most of my patients are on aspirin. And the problem is that I think aspirin is being prescribed a lot more, and somewhere we have forgotten that this is not a harmless drug and can cause side effects. The big side effect with aspirin is that it increases the risk of bleeding from the stomach. Okay, and it increases the risk by 12-fold. So you're 12 times more likely to have a significant bleed in the stomach as a result of taking long-term aspirin. All right. So that's one problem with taking aspirin. The second problem with taking aspirin is that a lot of people then give aspirin and then give something to protect the stomach against aspirin, and that is usually a proton pump inhibitor, which reduces gastric acid production in the stomach, and although that counteracts some of the harmful effects of aspirin, it does have its own adverse effects, because as human beings, we were supposed to produce gastric acid. Gastric acid is necessary to try and digest our food and absorb vital nutrients. And therefore, if you are reducing gastric acid production, you may reduce the absorption of some important minerals and ions, in particular magnesium. I've done a recent video on magnesium where I've shown, or where I've discussed, how proton pump inhibitors, lansoprazole, omeprazole, that kind of thing, can actually render someone hypomagnesiemic. And then, as you know from the magnesium video, that magnesium is really important and has a lot of beneficial effects on our body. So one problem is that people are taking aspirin. It can cause the bleeding. The second problem is people are then being given tablets on top of that to try and prevent the bleeding, which in turn causes nutritional deficiencies, which affect our health in an adverse way. So to my mind, I think it's really important for people who are taking aspirin to know exactly why they're taking the aspirin. Because if you don't, or if there is no real evidence base behind why you're taking the aspirin, then you should certainly not be taking it, because you may not necessarily be getting any benefit from it, but you may be exposing yourself to all sorts of other possible harmful effects. And of course, you're then taking, an extra tablet or two if you're also on a proton pump inhibitor. So from a heart perspective, and I'll restrict this to heart causes, heart reasons why you should be on aspirin, and how our insight has changed. From my perspective, there's only 3 reasons that people with heart problems should be taking aspirin. And actually now it should only really be 2 reasons. Okay, so the first thing to say is a lot of people take aspirin because they're known to have hardening of the heart arteries. Okay, so if they've got narrowings of the heart arteries or blockages in the heart arteries, then they say aspirin is helpful, although the evidence is not great, but people use it, and it's a reasonable thing to take aspirin. So if you've had angina, if you've ever had a heart attack, if you've had bypasses, if you've had stents put in your heart, then it's reasonable to take aspirin. In particular, if you have had recent stents within a year, if you've had bypasses within a year, then it's really, really important to take aspirin. Again, I say the evidence base is not wonderful, but still it's important to take aspirin. And I would certainly not advocate anyone coming off their aspirin if they have had heart artery narrowings or stents or bypasses in the past year. Okay, and even if it's been longer than that, it's really important to talk to your doctor about it before discontinuing aspirin or anything like that, because it can be dangerous. So that setting, I think it's very reasonable to take aspirin. Then there is another group of patients who've had strokes. Okay, and if you've had a stroke, then it's again very reasonable to take aspirin, because aspirin has an antiplatelet effect. It reduces clotting of the blood, and therefore it can reduce the likelihood of blockages in the blood vessels. So in that setting, it's very reasonable to take aspirin. There is a third group, which are patients who have atrial fibrillation, so an irregular heartbeat. And in those people, they used to be given aspirin to try and reduce the risk of strokes, because an irregular heartbeat, atrial fibrillation, and if you want to know about atrial fibrillation, please feel free to watch my atrial fibrillation videos. These people have an irregular heartbeat. An irregular heartbeat is associated with strokes, and people used to be given aspirin as a way to thin the blood to reduce the likelihood of strokes. The evidence is now overwhelmingly against the use of aspirin in this setting. Okay, most people would say that aspirin has no role in reducing strokes in people who have atrial fibrillation. And if you are taking aspirin, you're not going to get any benefit in terms of reducing the risk of strokes, but you're exposing yourself to a risk of bleeding. So, and those are really the only three, and so there are only two reasons why you should be taking aspirin. If you've never had a problem with your heart, if you've not had a stroke, then you should not be taking aspirin for your heart. And a lot of people do. I think that's just worth bearing in mind. So if you do take aspirin, please go and speak to your GP and say, look, why am I taking aspirin? I really need to understand why I'm taking aspirin. And there may be a good reason. You may have angina, you may have had a stent recently, completely reasonable to take aspirin. If on the other hand, you have none of those things, then I think it is a good idea not to take the aspirin, because it does increase your risk of gastrointestinal bleeding by 12 times. So I hope this was useful. Quick video, but this was something I learned yesterday when I was at this conference, and I thought I'd share it with you. All right, take care, all the best. Oh, by the way, here we go. The usual spiel, my website, yourcardiology.co.uk. This is me, Sanjay Gupta. Here's my Facebook page. And you can contact my long-suffering secretary, Jeanette, on this number if you want to talk to me. Just to really tell you a little bit about More Than Just Medicine, which is a new YouTube channel we've started, and we hope to put lots of videos out on lots of common medical conditions. We hope that one day it'll become the go-to source for people, so that they can find out about medical conditions in an easy to understand way. And so I would be really grateful if you could consider sharing my video, and also sharing the More Than Just Medicine channel information with your friends, because the more people that come to it, the more likely it is to be a success. So thank you so much. All right, bye.